Since the outbreak of COVID-19, there have been many varied reactions from society on prevention methods, not forgetting a number of conspiracy theories added to the confusion in some cases. Those in the media have had the difficult task of separating fake news from facts, as health scientists have been hard at work trailing the COVID-19 vaccine development across the globe. Joining us now to help us understand how the media ought to handle specialized information is Lopez Gonzalez, a senior health journalist who practices as an independent journalist now. Laura, a very good morning to you. Thank you very much for giving us your time. I want to go to Sunday, for example, and when the news emerged that there was an expiry date now that was attached to the AstraZeneca vaccine that had arrived into the country, alarm bells just went. Oh my goodness. The South African government has done it again, wasted millions of rand on a vaccine that they should have known is going to expire very soon. And as we are now being educated, this is part and parcel of the process around health reporting. How would you rate South African journalists and how they've handled this COVID vaccine?
I mean, I think it's been an incredibly difficult pandemic. It's unprecedented, the amount of information that journalists have had thrown at them every day. And it's unlike any other illness I've ever reported on in my 15 years of being a health journalist. So I think that there's a lot of commendable reporting. I think that the investigative reporters have again shown their caliber, digging up everything from PPE wrongdoing to making those kind of connections. I think it's very difficult sometimes to jump into health reporting because some of the sort of boring stuff, like how health systems work or how vaccines are regulated, how they're approved, can be difficult. And without understanding that, sometimes it's difficult to understand what you're seeing.
Yeah. And then, of course, Laura, you have conspiracy theories about 5G technology and the possible links, or should we say alleged links, which is completely untrue, by the way, which led in some instances in KZN to 5G towers being burnt down because the community genuinely was convinced by a leader, by the way, who's connected to the governing party, who went around spewing this wrong information. How would you rate the reportage around the conspiracy theories?
I think the conspiracy theories are difficult, and I think we have to kind of keep on top of them, especially when they're being touted by public figures. And I think we need to unpack them for audiences, because clearly, if disease spread through 5G, I mean, it makes no sense, right? So I think you have to unpack that and understand why people are thinking that, and then go into the sort of science in a way that kind of makes sense for people. So I do think it's important that the media continue to stay on top of those conspiracy theories. And I think that those things are with us for a while. And we also, I think, know that sometimes conspiracy theories or misinformation are genuinely people who don't understand how something works or have certain fears. But I think also we've known from watching what's happened with bots and the increase of anti-vaccine sentiment in certain social media platforms, that these are also tools that people use to kind of to sort of undermine other things in our society. They're used to breed distrust, and they're sometimes used for different ends. So I think people should definitely be skeptical of why people are spreading certain things.
Yeah, and while we're on the issue of public figures like Donald Trump, for example, who's going to say, don't stress too much about the COVID-19 issue. It's just a flu, don't be alarmed by it. The kind of impact that those kinds of statements have had on the public, would you attribute the kind of impact that this virus has had, in particular in America, where it's killed so many people in an advanced nation like America, to public statements that have been made by Donald Trump, the recent president in the United States, and perhaps the dangers that come with that, that people might actually genuinely have relaxed around these. For example, his rallies. People went there in some instances without masks on because he is also a kind of a person who is opposed to wearing masks and actually has often made fun of his opponent, Joe Biden, for wearing the biggest mask he's ever seen.
Yeah, so I think that we don't have this kind of research yet from South Africa, though I would expect it to be coming. But we do know from instances in Australia that most people, most people aren't anti-vaccination, right? There's a lot of people in a gray zone, depending on what vaccine you're talking about, that might have concerns about about vaccines. So when people who have concerns around vaccines, and we know those concerns change depending on what vaccine you're talking about, when they hear statements like that, it can sway their opinion on a vaccine. So it's really important that we make sure that public figures are well educated on vaccines, that they know that the regulator here in South Africa is very rigorous, and that whatever vaccine we're going to get is going to be safe. And I think that that's important work that we should be doing now.
Yeah, and then let's bring back the conversation, Laura, to the health space, which is what this is about. It's a specialized field. In journalism terms, we'll call it a beat, the health beat. What are some of the things to look out for? Because it's quite difficult for us to understand terminology, for example, because it is a specialized field. What are some of the things that we need to look out for and not be alarmist about when we hear certain things that have happened? Why is it important to just calm down and try and understand exactly what it is that you're trying to write about so that you do not cause unnecessary alarm to the public?
Yeah, I think that's a great question. I think first and foremost, what is very different about this pandemic is that the information is changing very quickly. And that's something that as a society, I don't think we're comfortable with, right? Because we're kind of used to having, when science says something, we have these big, there's kind of a conclusion, right? We're not used to information changing as fast as it is. So I think that in our reporting, we can just remember to kind of couch what we're reporting about in a way that says, this is an early result. This result, we'll expect final results later. This could change. So setting up our audiences to realize that this is a kind of a moving target in many ways.
Yeah.
I think the other thing to realize is that data can be hard. The figures are difficult, right? So you want to do the sort of same kind of storytelling things we do with most reports. You want to break down the numbers, make them easy, but you also want to remember that data can sometimes be very emotional. So when you sit there and you think about how you're going to present a percentage, is there anything about that figure that might alarm somebody? And do you need to look at the research and pull out any caveats that people need to know to understand that? And I think those are certainly some tips. But I think also in science reporting, some smaller words when you read research or when you listen to it being presented can be very important. So, and I think just finally, really making sure that we describe limitations. So for instance, when we heard the AstraZeneca news on Sunday, there was one, it was, an interim, it's sort of a phase 2 study that's kind of in the middle of making a vaccine. There was something that the study could show us, and there were things that the study couldn't show us. And what it can't show us is just as important to report as what it can show us.
It's so important what you're saying, Laura, because when, for example, you're told that the AstraZeneca vaccine is less effective in mild to moderate symptoms, but it is absolutely effective, although there is no clear data yet, for those who are severely impacted by this disease and are showing severe symptoms and are probably in hospital. It can confuse you because, okay, so this vaccine is effective to those who are suffering severe symptoms, but then for those with mild to moderate symptoms, it's not. That can be confusing, is it not?
Right. And so actually what the AstraZeneca results on Sunday showed was that it wasn't effective in preventing mild to moderate COVID-19 disease when tried against the variant that is now common in South Africa. What we don't know is what it will do to, if it will at all protect anybody from severe COVID. So we actually don't know what it's going to do in that sort of really serious disease kind of profile. And that's something that we're going to have to wait because it was a small study and it wasn't really designed to look at that. It was also a very healthy population. So we also don't know what it means for people who are older, who are more at risk, or people with underlying conditions. And that's an important thing to communicate, right? Because right now, our experts are sitting somewhere trying to make sense of the data, and they will basically have to make a decision whether or not that AstraZeneca lot that we have of vaccines, we know it doesn't protect against mild to moderate, but do we take a chance, knowing that the vaccine will do no harm, to give it to somebody who might be more at risk to say, okay, well, we don't know if this will protect you from COVID, severe COVID at the moment, but it could give you a better chance. So communicating that uncertainty about that, that trial result, telling people we don't know what it will do for that severe COVID is a really important thing to let our readers understand the process outcome that will happen probably later this week.
Laura Lopez Gonzalez, a senior reporter in the health field. Thank you very much for your time, and thanks indeed for those insights.